Hello, everyone. Welcome to Beyond the Headlines. It's officially afternoon. We're here today talking about Medicaid expansion, or rather the state's lack of Medicaid expansion, and Obamacare. I am Seanna Adcox. I'm the State House reporter. I've been covering these guys since 2005, the last four for the Post and Courier, and I'll let Lauren introduce herself.
Hi, everyone. I'm Lauren Sausser. I edit the health and science team at the Post and Courier. I've been here for about 10 years, and I cover healthcare issues for the newspaper.
All right, well, we got a lot of questions ahead of time, so we'll start with those. The first one comes from Richard, and he asks to please summarize what the low-income folks do now for medical care. Can you compare how their visits are covered now compared to what SC would pay for if we expanded the eligibility for them?
Okay, so this might be a little long-winded, but there's a variety of ways people who are low income can get health care. Obviously, some people who are low income don't get health care. There's a lot of different ways to define low income, but generally, if you're in South Carolina, if you fall below the federal poverty level and you don't have children, it's quite difficult to qualify for Medicaid coverage in the state. So when we talk about this coverage gap, a lot of these adults aren't insured. So if you're not insured and you need medical care, you still have options. You don't have as many options, but there are several low-income clinics across the state that accept patients who are uninsured, who accept patients who can pay fees sort of on a sliding scale. And a lot of times, though, the short answer is that people forgo healthcare when they can't afford to pay for it because they have other sort of pressing financial needs that take precedent over, seeing a doctor every year for a checkup. South Carolina is one of 12 states, and I wrote this article on Sunday, and some of you may have read it, that has not expanded Medicaid eligibility under the ACA. Sorry, there's a plane overhead or something. And it doesn't seem like South Carolina is going to do that anytime soon. But if the state were to change its position on this and these individuals became eligible for Medicaid, they would have insurance coverage for one, and they would have a greater choice of providers, and obviously most doctors, a lot of doctors in South Carolina, accept Medicaid, patients who are covered by Medicaid. So I'm not sure if that completely answers the question. I know there were several parts to it, but maybe we can touch on some of this stuff in other topics. And Seanna, I know you've covered this almost just as much as I have over the past 10 years. So if I'm leaving something out, feel free to jump in.
Okay, well, I'll give you first crack at this one. Liz asks, what are the chances a state as red as South Carolina will reconsider its stance in accepting Medicaid and expanding the ACA?
Well, there have been, Republican states that have expanded Medicaid under the Affordable Care Act in the past 10 years. I'll back up for a second, but basically when the ACA when the ACA passed in 2010, one of the major tenets of the bill, which really was trying to get everyone in the country covered in some form or fashion, was that it was going to expand Medicaid eligibility to everybody below that federal poverty level. But the landmark 2012 Supreme Court ruling made the Medicaid expansion optional by states. And so back then in 2012, going into 2013, I want to say that there were about half of all states that did not expand right away. Maybe it was a little less than half, but it was very much almost, if I recall, and I could be getting this wrong, a much more even split than it is now. Fast forward 10 years, going into 2022, we are one of only 12 states that hasn't expanded Medicaid eligibility. So a lot of, most of those 12 states are in the Southeast or in the Deep South. But there have been other Republican states that have expanded. To answer the question, though, it doesn't seem like it's a political reality in South Carolina right now. The governor, in the article on Sunday, his spokesman said that, his position is unchanged. It's not the decision isn't totally the governor's. It clearly would require legislative support too, but that doesn't seem to be there either right now.
So I'll sum it up a little more succinctly that I want to hear, but it's slim to none would be my answer. You know, in terms of McMaster opposing it, even if we had, say, a majority of folks in the House and Senate, which I don't think we do, he would veto it. You'd have to have a super majority vote to undo that veto, and we definitely don't have that. The last time, I think the last time there really was a vote on the House floor was back in 2013. And that was largely along partisan lines that failed. They tried to insert it in the budget. There was like a 5-hour debate. It failed. And then there was a push in 2015 following the Manual 9 massacre and the death of Senator Pinckney, because he had been a big supporter, and the Democrats were hoping once you got the flag down and maybe some minds had changed and maybe they could do this in honor of Pinckney. And I mean, that went absolutely nowhere. So sorry. I mean, like, so let's go on to the next question. So Ruth asks, what analysis exists of cost of not expanding Medicaid in South Carolina to insured residents? Or hospitals and other rates increase to cover non-insured people?
I think that a lot of people think so. I think, you know, there have been a lot of analysis to suggest that sort of there are these hidden costs that people who have health insurance pay for those who don't have health insurance. I think that it is difficult to draw a, you know, direct line from point A to point B. I spoke with, for the article on Sunday, I spoke with Christian Sora, who's a VP at the Hospital Association, and he used to run the Medicaid agency, and he referenced a study that found that health insurance premiums in non-expansion states like South Carolina are 2% higher than the premiums in expansion states, which suggests maybe there's this sort of hidden 2% tax. But again, that's really just a correlation. You probably can't, you know, say definitively that the non-expansion is causing that 2% increase. But, you know, there are costs associated with having a large number of people in your state uninsured. I mean, there's huge costs, but and those are, you know, yes, there are costs associated with having people uninsured, but you know, it's hard to, I guess, prove definitively. It's sort of one of those causation correlation arguments, I think.
All right. Frank asked that we please address how the Build Back Better Act would have an alternative solution for states that have not expanded Medicaid.
Sure. So there's the federal Build Back Better Act or bill that passed the House last month and is, I guess, up for debate maybe before Christmas in the Senate, but maybe not. It's very unclear whether it's going to pass the Senate, but as I understand it, it would provide, instead of giving people in the coverage gap Medicaid, it would provide subsidies to cover the cost of private health insurance on the federal marketplace or healthcare.gov. So basically, you would get a subsidy that covered all of your costs for a private plan, and that might be a plan through Blue Cross or any of the other people who are writing plans on the exchange in South Carolina. So it's kind of a workaround. It would be a workaround. It wouldn't be Medicaid expansion, but it would be covering the cost for private insurance so that, you know, this group of people, this large group of people would have insurance. But again, not guaranteed that that's going to happen.
Okay, the next one is Glenda asked, where does the largest chunk of South Carolina tax money go besides to Medicaid? And I'll actually take that one. The biggest chunk is education. K-12 education takes about 40%. If you add in colleges, it's about 50%. And Medicaid is about 27% of our general fund.
I don't know, and you know much more about this than I do, like what the breakdown of however much the state spends on education, I don't know how much the federal government is sort of matching. Like, what is that breakdown? I know what it is for Medicaid. Like, we spend, I think this year it's about $8 billion on Medicaid, but 70% of that is from the federal government. So I was just sort of curious what that breakdown is for education, if it's similar.
Well, it's not so simple because the federal money comes down in what they refer to as silos. It's money for Title I for kids. It's money for IDEA, which is kids with disabilities. And so it's not an even formula. Kind of like, South Carolina's own formulas are extremely complicated and all over the map in terms of different pockets. But by and large, South Carolina gets about $1 billion from the federal government, as opposed to of $9 billion worth of spending total for education in South Carolina.
Gotcha. So it's a much higher state share.
Right, and also we're talking local state. So there's a small federal share, and then there's a local and state mix depending on
gotcha
wealth of the district.
So it sounds like Medicaid is almost the opposite, whereas it's mainly federal money and it's some state money. I mean, it's still a lot of state money, but it's mainly federal.
And some districts get almost no federal money because if they don't, the wealthier districts don't have a lot of poor kids.
Gotcha.
So I'm going to compile a lot of questions into a general question. So doesn't it cost the state more in the long run in terms of cost, damaged economy, and worse illnesses and increased deaths for not increasing Medicaid?
You know what? That's a big question for sure. Like I mentioned earlier, there are costs associated with not expanding Medicaid. I don't think I could definitively say what's more. That's a hard question, but there are people that are dying because of this decision for sure. The state is spending, millions and millions of dollars every year reimbursing hospitals for the uncompensated care they provide. So just to break that down a little bit, if someone comes into the emergency room and is treated as is required by federal law, the hospital can write off what they spent on that patient. And the state Medicaid agency, using state and federal funds, is going to reimburse hospitals for some of those costs. So just because we're not, handing out a Medicaid card to everybody in that coverage gap, it doesn't mean that we're not spending state money on them. We're just sort of, someone I interviewed for this article called it rescue care. Instead of, covering them on the front end, we're covering them on the back end when they show up to the ER. So there are those costs cumulatively over 10 years. I couldn't put a number on that. It's estimated that, I think, estimates I've heard is it would cost the state about $250 million a year to provide Medicaid to this people in this coverage gap. I mentioned during the last question that the federal government covers right now about 70% of the state's Medicaid costs. It's actually a little bit more than 70% right now during the pandemic. But for this expansion population, if we were going to give out Medicaid to, this 100,000 plus people in the coverage gap, the federal government under the ACA has agreed to pay for 90%. So it's a much more sort of generous offer, if that makes sense, on the part of the federal government. We would get a lot more federal, they call it the 90-10 match. So basically the federal government is paying 90% of the cost, the state would have to pay 10% of the cost for the expansion group. And estimates I've heard is that 10% would be about, $250 million a year. So, and that's obviously a lot of money, but if you add up how much money that 90% is over the 10 years that have passed since the Supreme Court made this optional, you're talking about billions and billions of dollars. So there are a lot of different ways you can look at the money, the amount we're spending on ER care, the amount of federal money that we're turning away. And a lot of people would agree that, the number of people who are dying because they don't have a health insurance, and I've interviewed one of those people before. You know, there are certainly costs. I can't answer if those costs are greater or not, but there are certainly significant costs.
Well, let's do a step back for a moment and address, what is the coverage gap? Why do we have that coverage gap here in South Carolina? And
Sure.
what does that 100,000 represent?
Okay, so most people in South Carolina are covered by Medicare or through their employer, or are already covered by Medicaid. Medicaid already covers more than 1 million people in the state. So it's more than 20% of the state's population. Most of those people are kids, but there are eligibility rules for Medicaid are different in every state. There are a lot of commonalities and there are a lot of standards that the federal government sets, but because each state, like I mentioned, contributes some of the cost towards Medicaid, there is some latitude in crafting eligibility rules. And in South Carolina, adults without children, it's very hard for adults without children to qualify for Medicaid in South Carolina. So there is a coverage gap right now of people who, and I have to step back to the way the ACA was written. Sorry, I feel like I keep stepping back and stepping back. The ACA came up with a number of different ways that it was going to make everyone insured. And one of those big ways was it was going to create this health insurance marketplace. And you often hear that called the exchange or healthcare.gov. It's just the federal website, essentially, where people can go and sign up for health insurance. And a lot of people who do that qualify for really, sometimes really generous financial assistance to offset the cost of those plans. But that financial assistance is only available to people whose income is above the federal poverty level. And the rules may have changed during the pandemic, but when the ACA was written, I want to say it was for people whose income was between 100 and 400% of the federal poverty level. And just for reference, the federal poverty level right now for a single adult is, I think, $12,000 something. So you could make, I'm doing really simple math here, but up to, like $36,000 a year for a single adult. And when the ACA was written, qualify for financial assistance to buy health insurance on healthcare.gov. I think you can make more than that now, because the pandemic obviously put some hardships on a lot of people. But the law also, when it was written, was designed to cover everyone below the poverty level with Medicaid. But after the Supreme Court ruled that the federal government couldn't make states participate in the Medicaid expansion, there were coverage gaps in some states because states like South Carolina didn't expand Medicaid. So you have, it's kind of counterintuitive, but the poorest adults in this state don't get that financial assistance on healthcare.gov because that's not the way the ACA was written. So anyway, that's why there's this coverage gap. And there are, the last I checked, Kaiser Family Foundation keeps a lot of good statistics on their websites. There, I think there may be 200,000 people in this state that don't have health insurance. That's a ballpark figure. And a lot of them probably already qualify for Medicaid or qualify for those subsidies on healthcare.gov. They just may not know it or may not have signed up. But there are still, according to Kaiser Family Foundation, about 105,000 people in this coverage gap that can't get Medicaid, but also can't get the financial assistance on healthcare.gov. Now, they technically could go and sign up for a plan on healthcare.gov, but realistically, they couldn't afford it because there would be no discount, if that makes sense. So it's not that they're uninsurable, there's just no assistance for them to make coverage affordable. And they're mainly adults. They're all adults, I would say, probably.
Yeah, because our children are covered up to 400% of poverty.
I think it could be 400. I'm not sure. Maybe I'm not sure, but it's much easier. Yeah, I think 200 was popping in my head, but this is something I could go back and check for sure. But it's much easier for children to qualify for Medicaid coverage in this state than it is adults, for sure. I think that if you are a parent and you have a child covered by Medicaid in your house, then you can earn up to, I think, 67% of the federal poverty level and get a Medicaid card. So it's still a really low income threshold. But remember, once you hit 100%, this is a lot of numbers. I'm sorry, I hope it's not confusing. But once you hit 100%, you can get those discounts on healthcare.gov. So even within parents, there's this sort of gap between that 67% and 100% where they wouldn't qualify for help on either side.
So I'm going to go to some of the questions we've gotten while we've been talking. As what is the status of the Healthy Outcomes Program? Have we looked at that? That's the program that they put in as a sort of an alternative for Medicaid expansion. A decade.
Oh yeah, sure. Okay, so I did just get a question. Kids, Christian Sora answered in our chat. Kids are covered up to 213% of the federal poverty level.
Well, there you go.
Yeah, thank you. The Healthy Outcomes Plan was something that I asked about when I was reporting this article, because it was something that we wrote a lot about back in 2013 and 2014. And the way that it was presented back then was sort of Nikki Haley's administration's alternative to Medicaid expansion. So they acknowledged that they were not going to expand Medicaid under the ACA, but here was this group of people who need help and who need health insurance, and we're not going to give them Medicaid, but we want to do something else. So I may be getting these numbers wrong again, but as I remember it, the legislature passed a proviso this year, which is just sort of a one-year special allocation of money to fund the Healthy Outcomes Plan. And that money was to be distributed to hospitals, and hospitals were supposed to identify patients sort of in their coverage communities who were showing up to the ER too much. So chances are they were uninsured. They were basically, a lot of them, probably had significant healthcare needs, but they also needed preventative care. So the hospital's job was to come up with ways to better manage this patient population. And I guess they earn money out of that allocation. I believe that I believe in that first year, the target enrollment was 10,000 patients. And I think that the legislature has renewed that proviso every single year. So it's definitely still going on. I interviewed the new Medicaid director for this article, and he says that he is trying to analyze the data to sort of look at that the agency needs to do a deeper dive on that data to see sort of what kind of outcomes they're really getting for the money that's being spent. But that's been around for about 10 years now, for sure.
And Janet says that her representative says the costs are the reason he opposes. You kind of already touched on this, but what are the costs of expanding?
Yeah, like I said, I think it's between $200 and $250 million a year. That would be the 10% that South Carolina would have to find to pay for the expansion. And that's the argument that a lot of Republican lawmakers make. Interestingly, when Medicaid expansion was first rolling out, the federal government, at least for the first year or two, had agreed to pay 100% of the cost of expansion. And they were going to sort of roll back that amount until the federal government basically they said, long-term, we're going to contribute 90%, but to sort of ease our way into it, we'll pay 100% of the costs and then slightly less until we hit 90. But even when they were paying 100% of the costs, South Carolina lawmakers were not interested in the expansion.
When did that 100% dwindle down? Do you remember?
A few years afterward. I think now there still maybe some incentive. It may be like 95% right now, but it wouldn't be free. It wouldn't be 100% covered by the federal government that first year.
All right, we have a question on how basically people can advocate for the expansion. beyond contacting their legislator, which is probably the best bet, although I don't know how far you'd get on that.
Yeah.
Any suggestions?
I think that, I guess, like you said, if the goal is to get this group covered, it seems like the most realistic thing at this point, and I don't know how realistic it is to get this Build Back Better bill passed. I have trouble saying all those words together for some reason. So it may be worth, contacting your congressman. I guess that's about as much advice as I have.
And just on reality, another reason that would be complicating it for passage next year in the legislature is it's an election year. And, filing for primaries starts in March, and the Republicans are not going to touch this with a 10-foot pole. But you can certainly contact your legislators and let them know how you feel. And maybe there would be an opportunity in the future beyond 2022.
I mentioned, and I know Christian's listening in, we had a really interesting conversation with Christian, Sora, and Thornton Kirby, and Christian was telling me about this Kaiser family polling that was done, I guess, around the time that Trump was elected, and it was polling Republicans and Democrats on different policy positions, and one of the things that the poll found was that most Republicans and Democrats support Medicaid expansion. Now, these aren't necessarily Republicans; these are just constituents. These aren't, lawmakers. But one of the reasons that Medicaid expansion is still such a non-starter, like you have mentioned, is this is what Thornton and Christian were saying, is because it was always attached to this sort of the Obamacare brand, which for Republicans was toxic. So even though many aspects of the Affordable Care Act are popular among both parties, among voters in both parties, because it falls under the ACA, Republican lawmakers are obviously hesitant to embrace any of those different pieces.
Well, I know we're running short on time. This last question that's come in, maybe you can address what's available in our clinics, what kind of services they offer there, what services they don't, that people
like the federally qualified health centers. I mean, I think, that probably varies all over the state. I know that, our clinic, Feder Healthcare Network, covers a lot of the low country, and they cover, primary care and dental and different specialty cares. They provide gynecological care. And I think, when they can't provide something that a patient needs, the patient is often referred out to a specialist in the community. But yeah, there are a lot of different services that you can get. And insured patients go to Feder too. I mean, it's not just for uninsured patients, but they do offer a lot of different services.
And we're short on time, but maybe touch on some of our rural hospitals that have closed and how Medicaid expansion might have helped them. I know
this is tricky, and this is something that article was really long, and I couldn't touch on this, but from what I understand, the last time I checked, and this could be wrong, is that rural hospitals in South Carolina are already getting compensated for 100% of their, I know I'm using this word a lot, uncompensated care, meaning that when an ER patient walks in and he doesn't have insurance, the hospital is going to get reimbursed for all the total cost of that visit. That's not the case at the MUSCs and the Ropers across South Carolina. They are going to get, I don't know, I think it's about 50% of the cost of that. But because the rural hospitals financially have been struggling, I think the state has recognized that, they need more of a boost than some of the major hospitals. And so it's not that, and this is something that Christian and I had talked about years ago. So it's not necessarily that Medicaid expansion would be the silver bullet that these rural hospitals need. A lot of times, patients, even with insurance, are just sort of bypassing them for larger hospitals. That's a complex problem for sure.
All right, well, I think we've hit our magical limit. But thanks
Thank you.
for tuning in, and you can feel free to, email either one of us.
Yeah, absolutely.
Do you want to give your email address?
Yeah, my name is Lauren Sausser, and the email address is lsausser, LSAUSSER @postandcourier.com.
And mine is SADCOX @postandcourier.com. Hopefully a lot of you already subscribe. If you don't, you can go to postandcourier.com/subscribe, or we have lots of free newsletters that you can sign up for, and maybe you already sign up to those as well, but that's at postandcourier.com/newsletter/sign up. Thank you again for tuning in, and have a great rest of your day.
Thanks, Shauna.
Thank you.